Good morning, good afternoon, good evening to all our live audiences and, of course, nurses watching right now. Welcome to our Facebook Live event. And, of course, thank you for joining us today. I am Rachel Ohastro, Marketing Specialist of Town Kids, and we are honored to have with us the CEO, the one and only, ever beautiful Miss Mindy Diner. Hello, ma'am.
Thank you. Hi, Rachel. Thank you
Good.
so much for having me.
Of course. Thank you so much for your accepting this interview, ma'am. Miss Mindy will be sharing with us her insights about the organization's mission, their values, and how they overall support the nurses and our healthcare professionals. So, Miss Mindy, ayan, we can begin now. Right. So to begin, ma'am, with our first question, can you share with us what is the mission of Town Kids?
So, our overall mission is to help and care for medically fragile children. And these are children with complex medical needs who need professional skilled nursing care and often are in hospitals and facilities. And no child deserves for their childhood to be in a hospital room, in a hospital bed, surrounded by doctors and nurses. We believe that every child belongs at home with their parents, their siblings, their loved ones, and that's our mission. Our mission is to ensure that every single child has the ability to heal at home.
That's very sweet, Miss Mindy. But what core values, ma'am, guide our nurses or how we treat our nurses, ma'am, our employees and our partners as well?
So it's interesting. When we started Town Kids, we that was one of the first questions we asked ourselves. What are our core values? And I think the first question is, why do we need core values? And obviously they help guide us. And this ensures that every action, every decision is done with intention. But it also helps us create that community with our nurses. And that's what Town Kids is looking to do. Town Kids is looking to create a community that our families and our nurses are a part of. And what's a community, right? A community is, I mean, it's 2026, right? A community doesn't mean you all live in the same place anymore, right? You don't need to be with each other physically to be part of a community. Community can be somebody who's thousands of miles away. And what guides a community and what brings a community together is our core values. And we want to make sure that as a community, we're all aligned. So we do have five core values, and I know that we do not have all day now to discuss every single one of them. But I could talk about, obviously, one core value is commitment, community, integrity, empathy, and evolving with purpose. And what makes our core values unique to us are various things, right? So something like integrity, right, doesn't necessarily set us apart. Everybody, not every, I shouldn't say everybody, but I would assume most people pride themselves on most people and most organizations pride themselves on integrity, right? But why did we choose it? We chose it because we wanted our nurses to know that integrity is everything and that it actually means something to us. Empathy, we pride ourselves. We started our organization to care for kids. We started Town Kids because we felt for these kids and we wanted to make sure that they can heal at home. That's our whole mission. But we also wanted to make sure that empathy guides us in how we relate to our nurses, how our nurses relate to their clients. And empathy is really a guiding light when we're making decisions, when we're doing things, especially nurses who are coming to a new country, have never been here, are facing challenges that most people don't face. And we want to make sure that as their employer, that we are treating our employees with empathy. And of course, my favorite one is evolving with purpose. And Town Kids wouldn't be where we are today without this core value. Where we Town Kids is started about 5 years ago today, actually. Yeah, 5 years ago. And we started out then recruiting nurses, starting the immigration process, and every part of Town Kids at that point was new. And when you're building a company, you're always facing new things, new questions, new decisions. And that's how we have evolved. How are we going to do this in a way that helps us build, that helps us grow, and that helps every single one of our nurses be set up for success? And in order to do so, you're not necessarily doing something just because everyone else does it or just because that seems like the easiest way to go. You are evolving with purpose. You're saying, okay, does this align with us? Who is this going to help? How do we need to adapt and change in order to be better and in order to make sure that our clients get the best care and our nurses are in the best place? And that's a question we continuously ask ourselves every single day.
I agree with that, Miss Mindy. In the 5 years that Town Kids is starting in this Town Kids is in the industry, you have been growing, right, Miss Mindy? And with it, of course, we are really I would like to emphasize that, worker protection, ethical recruitment, these are all important topics here in this industry, most especially in the healthcare
Absolutely.
staffing, ma'am. And with this,
Absolutely.
ma'am, how do you think, ma'am, Town Kids ensure that our nurses are treated fairly and supported all throughout their careers?
We rely very heavily on our core values because, like I said, that's really our guiding light. And it's really helped align us over the years and ensure that our nurses are treated ethically and fairly. And truthfully, we've built our entire program around our nurses. And I always like to say that Town Kids is for nurses by nurses because there's not a lot, when I started Town Kids, I tried to look out, see who else is out there, who else is recruiting nurses for home care. And what I found out is really no one. And I realized that in order to build a program that is fair to our nurses and ensures that they are treated really the best is to build a program that's for nurses by nurses. And we follow whatever industry standards do exist, and but most of all, we really listen to our employees and we talk to them and we ask them and we listen to them. And that's really our guiding light. It's that empathy. It's building a community of people who we can talk to each other and have these kind of conversations, and realizing that our responsibility, besides for client care, is ensuring that every single nurse is set up for success. We know that every nurse who's joining our program is relying on us, and it's a huge responsibility. And we take that responsibility seriously. And that's the question we ask ourselves every single day is, are we taking care of our nurses in the best possible way?
So you mentioned, ma'am, that we strive to support our nurses in the U.S. And with this, ma'am, do we have some ways to help ensure these nurses and develop their skills, advance in their careers?
Absolutely. I mean, we have an entire program that we built just for this. And that's actually something that's also evolved over the years, right? When we first started out, we knew that we were going to be training our nurses specifically for home care, and we built a program. And as the years went by, and we saw, we looked at the training and we listened to our nurses' responses, and we saw how it affected our quality of care. And we've even adjusted it over the years to accommodate. But just to talk a little bit about it, the training already starts in the Philippines, as many of you already know. And we have a beautiful training lab here in the U.S. With all the state-of-the-art equipment. And the most incredible instructors in the world. I cannot take credit for this training. It really, really huge shout out to our clinical team who educates and trains our nurses. They do such a fantastic job. And it's making sure that they're set up to go out on the field and they're set up also for success. For the nurses that, everyone's different. Some people need some re-education or coaching or a little bit more one-on-one. And I think that's really the key is, yes, we've built a program, but also realizing every nurse is an individual and everybody has their own individual challenges and needs. And if there are some that need a little bit of extra support, what's really great about the support system we've built is not just the professional side, but it's also the personal side. And we have an entire clinician success program that's built around supporting our nurses personally, right? Every nurse is moving to a new country and starting their lives over. So, what are we going to do to support them? What are we going to do to help them settle in, find housing? We have interest-free loans when nurses arrive. So, and halfway through the contract. We offer amazing benefits. And actually, one of the decisions we made in the beginning, and we still do today, is that the health benefits start right away. Many companies don't do that, but we know that our nurses are arriving in a new country, so we're going to make sure that this is something they have access to right away. And they're just, I can go on for hours because, as you can tell, I feel very, very passionately about it. But this is really what our entire program revolves around. How are we setting up our nurses for success, personally, professionally? We have the most incredible success stories. I mean, besides for the fact that 100% of our nurses have been placed successfully at clients, we have some nurses who came in and struggled in the beginning. Maybe they had, less experience, or they just weren't connecting with families. And I had some of the management team come over to me and say, what are we going to do? Like, how are we going to help this nurse? We just, we can't seem to find the client that fits, or she's just not getting the skills. And the answer is, this is our nurse. We are going to make sure we're going to do everything possible to make sure that this nurse is going to succeed in some way. So we have to find a client that works. We have to go down and coach them in person. And we have some nurses who, I'm telling you, if you saw where they started off at Town Kids and where they ended up, some nurses who we were really just, what are we going to do? And they ended up as trach vent nurses, some on the most highly complex cases that we have. They must be so proud of themselves. I am so proud of them. I'm so proud and impressed with our staff who really coached them and educated them and held their hands. Those are the stories that we really are the most proud of. So I'm sorry that I went on, but this is our goal. This is what we do every day.
That's actually a good story, ma'am, because I am seeing, and I know that all our live audience right now are seeing your compassion, your dedication really to your work, and to our nurses who we've been transitioning here in the Philippines, and they're from the Philippines, they're in the US. And actually, ma'am, my next question is a bit more serious, ma'am. And these are for all the nurses right there who are trusting us, continuing to trust us, ma'am. But with this question, ma'am, I'd like to know, what do you think sets Town Kids apart from our competitors?
I think so first of all, the amount of support that we give to our nurses, we have a huge emphasis on it. The fact that we have an entire department built around that, our clinician success team, is really, really significant, and really different than what anyone else does, because you really can't underestimate the support that our nurses need when coming in. It's hard. You're starting over. You're starting a new life. So this department, whether it's emotional support, whether it's mentorship, whether it's professional support, whether it's just, where's the best grocery to buy fresh fruits, or how do I do my taxes, or, you know, when it comes to buying a house, right? Like, how do I get approved for a mortgage? So having a department of employees who have part of clinician success, have many of them have been through this system themselves, right? They went through this process already. And then they can talk from personal experience and help their fellow nurses. So that really differentiates us. And the fact that we are home care, that our nurses are working with patients on a one-to-one ratio. They're going into people's homes. They are working with their client and just their client. And the fact that we are willing and able to train our nurses for the work that they're going to do. So, we know that when recruiting international nurses, not every nurse has recent experience or the specific experience that's needed to come to the US and and operate where we need them to operate. So we've built a training program to make sure that these nurses, who are the most amazing nurses in the world, are going to be trained specifically for home care and really set up for success.
And what role should organizations, ma'am, like Town Kids, play in raising the standards, protecting the welfare of our nurses, of our workers in the US, ma'am, who come from other countries, most especially in the Philippines?
So that's something that we ask ourselves a lot, actually. And like I said, this is a responsibility. Actually, we're not just setting up a home care agency or recruiting nurses to come to the it's a real responsibility, knowing that we have nurses who are relying on us to bring them into the U.S., to give them, provide employment, and not just to provide employment, but provide employment that they're good at, that they can grow in. And it's a huge, huge responsibility. And we ask ourselves this question all the time. And I really think that our role is to be at the forefront, to keep asking this question because we want to keep it front and center, but to be at the forefront in the industry of of creating a process, um, and ensuring that we are influencing, right? We're not just doing it for ourselves, but we're influencing others in the industry, to that transparency is important, that our role is so significant, and it's on us to be transparent, to protect the welfare of our nurses, to ensure fair pay, to ensure that the working conditions are setting them up for success and are fair and are comfortable. So that's a responsibility that's on us. And again, I really think influencing others in the industry so that this becomes an industry-wide standard. And who knows what can happen, other people I wish, I would love to get phone calls from others in the industry. Hey, what do you do? And share our best practices, because I really think others can learn from it. And I'm excited, and I would be excited to see that across the board, because and any employee to begin with, and anyone who's in the international recruiting industry needs to understand this importance and really, really work on it every single day.
Obviously, ma'am, with in my perspective, hearing your answers, ma'am, you have been building a great and continuing to build a great company supporting not only the nurses but of course our clients, the patients. With this, ma'am, what is your vision for building trust among Town Kids employees, our nurses, our partners?
Well, our vision, obviously, you can tell that we place a huge emphasis on that community and that trust with, between us and our employees. And we're pretty good at it, I have to say. We have wonderful relationships, and we've seen, a lot of our nurses even stay on after the contract, which has been really, really nice to see, actually. um, and I think that there's also the angle of the trust that's built between the nurses and the families that and the clients that they care for. These are nurses who are going into people's homes. It's as personal as it gets. Doesn't get any more personal than home care, right? And they're working with this patient and they're connecting with the family. And it's really building that trust between the nurse and the client and the parents so that they have that trust with each other and can build that lasting relationship, which ultimately, listen, it helps us achieve what we're here for, which is really to help these kids. And if we have that high level of trust, then at the end of the day, we all win.
Right, I agree with that. And actually, now we are now down to our last question, Miss Mindy. If there is one message you would like everyone to remember, what would it be?
Okay, I'm going to leave off with the message that I tell every new group. So if you're watching this and you've already heard me say it because you're already in the US, then it doesn't hurt to hear it again. And if you haven't gotten here yet, then when I meet you at orientation, you're going to tell me that you watched this video and you remember this already. That message is be patient with yourself, be kind with yourself. This whole process of coming to the US and moving to a new country. Let's take a step back. Going through the immigration process with USCIS, right? So retrogression and the visa bulletin, right? And then coming to the US and moving to a new country and starting your life over, whether you're coming yourself, whether you're coming with your family, and then starting a new job, right? Many of us have started new jobs. We know what that transition is like. So everything combined, it's a lot. The biggest piece of advice I can give you is be patient with yourself. Some people come in right away, they click with the client, they found the house, they just have it all together. And some people don't, many don't actually. And that's okay. Don't compare yourself to your friends, don't compare yourself to your colleagues. You are an individual. You are going to adjust and adapt and evolve with purpose the way that you are meant to. And the best way to do it is be patient with yourself, be kind to yourself. That's our goal. We're bringing you into the U.S. When you arrive in New Jersey. We understand that that's what we're here for, to help you adapt and to help you succeed. And the best way to do it is to know that you're not the first one, you're not the only one. You are now part of the Town Kids family, and you should absolutely lean on us. And we are very excited to meet you one day.
That's a very lovely message, Miss Mindy, and a relatable one. Like, be in your pace. Now, you're not competing with others. Just work, and continue life.
Yes,
Thank you
it
so
falls into
much.
place.
Thank you so much, Miss Mindy. And I guess that brings us to the end of our conversation today. Again, thank you so much, Miss Mindy, for accepting our interview. And on behalf of the team, we'd like to extend our sincere thank you to you, Miss Mindy, for sharing your time, your insights, your vision with us, and of course, your leadership and commitment to supporting nurses and healthcare professionals truly reflect what Town Kids stand for. And of course, to everyone who joined us live and participated in the comments right now. Thank you for being a part of this discussion. Your engagement and your continued trust mean a lot to us. Right, Miss Cindy?
All right. Thank you, Rachel. Been great to be here.
Thank you so much. If you'd like to learn more about Town Kids, our programs, and opportunities for nurses, please feel free to send us a message or visit our official channels, everyone. Once again, thank you for trusting and for tuning in. I am Rachel Ohastro, Marketing Specialist of Town Kids, wishing you to stay safe, and we look forward to connecting with you again soon. Thank you so much, everyone, and have a great day. Thank you, Miss Mindy.
You're welcome. My pleasure. Anytime.